coronavirus.
A SARS-like virus which has infected hundreds in China.
Globally, nearly 1.5 million confirmed cases of COVID-19.
An ounce of protection is worth a pound of cure.
By now, you have undoubtedly heard about the novel coronavirus called COVID-19. In nearly every country, including India, people are becoming infected with COVID-19. Some people even die because of it. To slow down the fast spread of COVID-19, Indian leaders have put the country on lockdown. This is because COVID-19 has a high death rate, at least 10 times higher than the flu. So far, there is no vaccine for COVID-19 and no cure for it. Given the seriousness of the situation, we would like to answer 3 questions about the new coronavirus, COVID-19, in this video. First, what is COVID-19? Second, what can you do to protect yourself and your family from COVID-19? Third, what can we do together to protect our communities and society? Let's start with the first question. COVID-19 is a human coronavirus recently discovered in Wuhan, China in December 2019. Infection with COVID-19 causes symptoms ranging from a mild cough to severe pneumonia and death. Coronaviruses are a large family of viruses which may cause illness in animals or humans. In humans, previously 6 coronaviruses were known to cause infections. 4 of them produce common cold symptoms, and 2 of them, Middle East Respiratory Syndrome, MERS, and Severe Acute Respiratory Syndrome, SARS, result in severe illness. COVID-19 is most similar to SARS, which resulted in a severe but comparatively small global outbreak in 2003. However, COVID-19 is far more infectious and thus more able to rapidly spread around the world. Unfortunately, COVID-19 has now already spread to almost all countries in the world, and there are many, many people infected. Experts believe that a large portion of the Indian population will be infected with COVID-19. Among infected people, 4 out of 5 cases develop mild or moderately severe symptoms. Oftentimes, for instance, an infected 30-year-old will tell their friends that they had the worst flu symptoms of their life and feel weak and tired for several weeks afterwards, but they might not have needed to go to the hospital. About 1 in 5 infected people will develop severe or critical symptoms requiring medical attention. In addition, people can spread the disease long before they show symptoms. Because of that, countries or areas may lock down even when only a few cases of infection have been detected. This is usually a sign that many more people are infected but are not showing symptoms. Older people and people with pre-existing illnesses such as diabetes, high blood pressure, asthma, obesity, and a history of cancer are more likely to have life-threatening symptoms. However, even young people and healthy people can get COVID-19 and die from it. In many hospitals in the world with large numbers of COVID-19 patients, doctors have remarked with shock that half of the people requiring ventilators were people under 40 or 50 years old. Children infected with COVID-19 are the least likely to experience serious problems or death, but they can also be carriers of the disease. Indeed, children seem to be very infectious. Now that we understand what COVID-19 is and how serious it is, let's go to the second question. How can I protect myself and my family? To help answer this question, we need to understand how COVID-19 spreads. The most common method appears to be when an infected person breathes, coughs, or sneezes. Small droplets leave their mouth, containing the virus. The small droplets can enter the mouth, nose, and eyes of people nearby and infect them with COVID-19. Scientists are not sure how far these small droplets can travel in the air. Some new research suggests that droplets from a sneeze can travel as far as 8 to 9 meters. Furthermore, the small droplets can sometimes stay in the air for up to 3 hours. In addition, the water in the droplets can evaporate, resulting in the virus becoming like tiny dust particles, able to travel very long distances through the air. To make matters worse, a person infected with COVID-19 may look perfectly healthy, but could still spread the virus. Because the coronavirus can spread through the air from person to person, it is important to take the following steps to protect yourself. Stay home. Since infected people spread the coronavirus, the best thing you can do is stay away from infected people. At this time, there are no easily available rapid tests that let you know if someone is infected or not. However, these are being developed, and since someone who is infected might not feel sick, it is important to avoid people outside your household as much as possible. Avoid all non-essential trips. You might need to make a trip to get food or medicine. Of course, you should not meet friends, play a game of cricket, or go to the park. The basic idea is that you need to minimize the number of people you come into close contact with, especially because you do not know who has COVID-19 and who does not. If you go out for an essential trip, go to places where there are few people. Stay at least 2 meters away from others. In some Indian cities, shopkeepers and local authorities have drawn circles with chalk so that shoppers maintain a safe distance from each other. Even if the stores near your house don't have such chalk markings, you should maintain appropriate distance from other people to avoid person-to-person infection. When you go out, wear a mask. Even a cloth mask is better than nothing. And do not adjust or take off the mask until you return home. You should only touch your face after you have washed your hands with soap. Remember that you want to avoid the small invisible droplets that might come near your face. Because the droplets do not always travel far, distance lessens the chances of infection. Turning your head and wearing a mask can prevent droplets from entering your mouth, nose, or eyes. Besides the small droplets in the air, a second important way COVID-19 spreads is through contacting infected surfaces. A person infected with the coronavirus may have left droplets on different kinds of surfaces. If you touch a surface with your hands and then bring your hands to your face, a droplet containing the virus could transfer to your nose, mouth, or ears, and you could become infected. These surfaces include things like door handles, tables and counters, packages, and so on. The coronavirus survives on different types of surfaces for different amounts of time. According to the New England Journal of Medicine, one of the top medical journals, the coronavirus can survive up to 24 hours on cardboard. On harder surfaces like plastic and metal, the coronavirus can survive up to 3 days. Your hand may touch a surface with coronavirus on it. If you then touch your face, the coronavirus can enter your body. Because the coronavirus can survive on surfaces for some time, it is important you take the following additional steps to protect yourself. 1. Regularly wash your hands. Wash them for at least 20 seconds using soap and water or an alcohol-based hand rub. Soap is very effective. The outer shell of COVID-19 is made of fat molecules that can be broken up or dissolved by soap. It does not matter whether the soap is antibacterial or not, any soap will work. You can also use an alcohol-based hand rub. Make sure that it contains at least 60% alcohol. Just make sure you scrub all parts of your hands, as the virus has also been repeatedly shown to cause diarrhea in some patients and can be detected in fecal material. Making sure you wash your hands after you go to the bathroom is very important to reduce the spread of COVID-19. Regularly clean surfaces with disinfectant cleaner. Clean door handles, elevator buttons, and tables, especially in areas which are visited by lots of people. Use bleach mixed with water, 1 cup of bleach in 12 liters of water, or you could use another standard household cleaner. Remember to wash your hands after cleaning, and keep bleach and cleaners out of the reach of small children. Remember, small droplets containing COVID-19 can stay for hours on surfaces. If you touch a surface with COVID-19 and then touch your face, you could infect yourself. By regularly cleaning surfaces, you will reduce your likelihood of being exposed. Also be careful with bleach and household cleaners. Do not inhale them, drink them, or get them in your eyes. Most importantly, keep these potentially dangerous chemicals out of the reach of small children. Note that washing your hands and cleaning surfaces will likely result in decreased illnesses from other viruses also. Use care when handling packages or groceries. You can use a cleaner to wipe the outside of a package or groceries before bringing it into the home. You can also let packages sit outside your home for a few hours or even a day or two. If someone who is infected has been close to a package, it could have COVID-19 on it. This is because, as you remember, COVID-19 can survive up to 24 hours on cardboard and several days on harder surfaces like plastic. Eat a well-balanced diet with a lot of fruit, particularly citrus fruits like oranges. Vitamin C is increasingly recognized as important in fighting the virus, and patients in New York City hospitals are being injected with vitamin C to help them fight the disease with promising results. However, vitamin C is not a cure. There is currently no cure for coronavirus. 5. Be positive, action-oriented, and cheer yourself and others in your household up. If you or those around you become sick, inner strength, humor, resilience, and positivity, the powers of the mind and heart, are among our greatest defenses against illness. Let's summarize some of the main points we have learned to protect yourself and your family. Stay home. If you have to go out, avoid other people and wear a mask. Wash your hands with soap. Wash your hands frequently. Disinfect surfaces like door handles, buttons, and tables regularly. And be careful with packages that may have been handled by someone else. We just discussed how to avoid COVID-19, but what do you do if you think you already have COVID-19? COVID-19 can have very similar symptoms or signs as a regular cold, with symptoms like fever, coughing, a sore throat, and muscle pains. More severe symptoms include shortness of breath. You could have any mix of symptoms. It is different for different people. Call your doctor for a test if you have serious symptoms, particularly if you have difficulty breathing, but do not show up at the hospital unless you cannot breathe. Remember that COVID-19 can spread through the air, especially when in close contact with other people. If you have to wait at the hospital with other people who are infected, you are likely to get the infection, even if you didn't have the infection before. 2. If you know anyone who has these symptoms, encourage them to call their doctor too. 3. Only take prescription medicines if a doctor recommends it. Be skeptical of quack doctors. Taking prescription medicines without a doctor's approval can be dangerous. 4. Don't believe people who are trying to make money by selling miracle cures. If anyone promises a miracle cure or protection from coronavirus, be doubtful. If there was a cure, the top health experts in the country would tell us. It would also be in all the reputable newspapers. If someone tells you about a cure, first check with reliable, expert sources. 5. Be careful of fake news. For example, you may have heard that putting oil in your eyes or gargling with warm water will stop COVID-19. These practices will not help. You can fact-check fake news like this on this website created by IIT Bombay students. There are lots of new WhatsApp messages and websites advising us what to do. It is always best to check whether they are based on expert advice or not. The best way to check messages and news is to see what multiple high-level experts are saying in reputable websites and newspapers. As they learn more, government officials and health experts will use their authoritative channels to inform us what we should do. Now that we understand how you can protect yourself and your family, let's go to the third and last question. How can we protect our community and society? Think about your best friend or an auntie or uncle. How would you feel if they got sick? How would you feel if you infected them? You need to protect yourself, but you also need to protect others. Remember, even people who feel healthy and don't have symptoms could have the coronavirus. You could have it and not even know. In other words, you could be a carrier of the coronavirus and infect your friends, neighbors, and relatives without even knowing it. So what can we do to protect our community and society? The first and most important thing is to practice social distancing, which is when people avoid contact with others. You can do this by staying home. If people reduce their interactions with one another, COVID-19 is not able to spread as easily. The more people that are in contact with each other, the higher the chance for the virus to spread. We can see why in this video from the Washington Post. Each red dot is an infected person. Each blue dot is a healthy person. Notice what happens when everyone moves around regularly. The disease spreads rapidly. Now let's see what happens if some people socially distance themselves. Notice how the infection doesn't spread as quickly. Why is it important for us to slow the spread of COVID-19 through social distancing? If less people get infected, our doctors and hospitals can take better care of them. Imagine there is a city of 1,000 people and the local hospital can support 100 people at any given time. If all 1,000 people get infected at the same time and go to the hospital at the same time, it will be impossible to treat them all. This is what happened in Italy, where few steps were taken to slow the disease and the first patients were undiagnosed. Because too many people got infected at the same time, doctors had to make very difficult decisions about treating some people and not others. This led to lost lives. However, if we slow the spread of COVID-19 through social distancing, only some people get infected at any given time. Then doctors can more easily treat people when they come a few at a time rather than all at once. This is called flattening the curve. Let's watch this video.
People are talking about this virus, especially since we've seen in other countries that it can become widespread, like in Italy. There's this notion of flattening the curve or flattening the wave. And what that's referring to is if you think about a wave sort of coming through an area and then moving past the area, think of the wave or the curve as being the number of patients in the community that actively have that infection. Well, a certain small percentage of the people that have that active infection could become more ill and require healthcare services. And so if the wave is very big, then there will proportionally be more people that need healthcare services. And what we want to do is try and flatten the wave so that it's within the capacity of our community's healthcare system to handle anything that comes our way, whether it's sick kids that have cough and cold and need attention, or whether it's somebody that's very ill and needs to be in the hospital and treated for pneumonia.
To encourage social distancing, the Indian government has called for a lockdown period where everyone is supposed to remain at home as much as possible.
The issue of lockdown, where we are having to stay indoors and spend a large amount of our time inside the house with this fear of something that may happen to us.
Even if this lockdown period is lifted, it will be important to reduce interactions with others until the number of infections goes down. Otherwise, COVID-19 could hit your region even harder in later months. Another important way to protect others is to quarantine yourself if you feel sick or if you have been around someone who might have coronavirus. Here are a few points. 1. Quarantine means avoiding physical contact with other people, even within your home. 2. A quarantine person must stay in a separate area in their home, away from other family members. 3. A quarantine person must also avoid sharing household items, such as utensils, with other people at home. 4. A household with a quarantine person must also minimize visitors to the house. On average, an infected person who does not quarantine can infect 2 to 3 other people. This can then result in what is called exponential growth. The idea of exponential growth is that one person infects 2 people, who infect 4 other people, who infect 8 people, and so on. 20 transmissions later, the number of infected people has grown to 1 million. So if you or a family member are sick, make sure that you stay in quarantine. Another way of protecting others if you are sick is to wear a mask. Remember that COVID-19 can infect others through your breathing, coughing, or sneezing. Also, if you are sick, throw your tissues away in a trash can with a lid. Make sure that your surfaces get cleaned. Remember that others can get infected by touching the tissues and surfaces that an infected person has touched. Furthermore, it is important to let other people know that you are sick. Let people know over Facebook or WhatsApp. Do not meet them personally. If you have symptoms that could be caused by COVID-19, you may have acquired it 2 to 14 days before you felt sick. You will want to tell anyone you met during that time to be careful. Even if you are not sick yourself, you may have seen or heard about other people violating the lockdown. A lot of people often ask, why should we not go out, or why should we be careful when we are not infected? It is your social responsibility to encourage other people to stay home and separate themselves. These people are not only risking their own lives, but they are risking the lives of others. You should speak up. Tell them not to do it. Share information and explain the risks to other people. Let them know how the virus spreads. People who seem like they don't have symptoms can still be infected. You have the ability to save lives. Some might argue that Indians may have higher immunity to COVID-19. However, this is not true. According to health experts, humans do not have any immunity to the coronavirus. If Indians were immune to COVID-19, we wouldn't have infections and deaths. Remember that any of us can become infected with the virus, and any of us can infect others with the virus. We are all in this together. Do not send out messages that blame people or societies. It doesn't do any good. This invisible coronavirus can infect and be spread by anyone. It does not matter which country, race, religion, class, or caste they come from. We can only overcome this pandemic by working as one world family all together. A question that many of us have is, how will this end? And the only true answer to that question is that nobody knows. Scientists are working very hard to find a vaccine against COVID-19, but it is estimated that this process will take at least 12 to 18 months. If rapid testing becomes possible or a cure comes up, we also might be able to relax some of the protective measures that we need to take just now. Human beings have an incredible ability to adapt to any situation, so it is important that we continue to live our lives, even during lockdowns. It is important to be kind, to help our neighbors, and to continue learning, loving, and laughing, to keep our spirits high, and remember what makes us human.